Hello there, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. What I'd like to talk to you today about is CIPN, chemotherapy-induced peripheral neuropathy. And what you need to know is, one, it's not fun. It's bad enough you have cancer, but this is sometimes, actually quite often, associates the chemotoxicity that kills the cancer. It also does damage to the nerves. And when the nerves aren't working properly, you can have a lot of stuff going on, a lot of bad stuff, okay? And it's kind of frustrating for the patient and for the doctors managing your case because, neuropathy is many, many things. It's numbness, tingling, loss of feeling like you have rocks in your shoes, you can't feel your hands, or weakness, balance issues. It goes into a lot more, and I'll touch base on that as well throughout our podcast today. But again, CIPN, chemo-induced peripheral neuropathy, okay? What happens is the symptoms can emerge anytime during the course of cancer treatment, okay? Typically, the onset is observed weeks or months after the initiation of chemotherapy. Some patients have an acute onset, which is not as common. I mean, the nerves it hasn't enough time to do damage to the nerves. What happens is, though, it's challenging because what's called a coasting effect. And this is where symptoms continue to progress and even worsen for months following the cessation of chemotherapy treatment. So this tells us that the toxicity of the drugs used to cure the cancer, they're self-propagating. They continue to inflict nerve damage even after the drug is stopped. So if you chemotherapy, this is still in your system. It doesn't just walk out the door as we wish it would, but it's one of those things that just over a period of time, the symptoms get worse. The stuff associated, even though you stop taking the chemotherapy. So it's kind of, it's not a walk in the park. And depending on the severity, we're able to help some people, but not everyone. Not everyone's going to respond to the treatments we do here because there is no pill, okay? People will take gabapentin, Lyrica, Cymbalta, or Neurontin, to dumb down the nerve. But the nerve is dumbing down because the toxicity is causing the nerve. So the nerve isn't flowing properly. And as a result, you dumb it down more. You might, in the short term, buy yourself a little bit of relief, but the stuff when you start taking, again, Lyrica, Cymbalta, gabapentin, are all pretty serious there. And so it's something that you have to deal with. But fortunately, there are ways to mitigate it, but not everybody qualifies. It's just one of those things here. I say we probably take maybe 4 out of 10 patients for care. Now, we're not treating. What we're doing is we're working to stimulate blood flow, make sure the nerve is getting adequate blood flow, adequate stimulation, okay? And then we're trying to revive it. And one of the things we do is we send people home with this laser that I find to be absolutely incredible because the laser helps to dilate the blood vessel. If you open up the blood vessel, you're also going to open up the nerve, and you get more blood in because the blood's going to heal the damaged nerve, okay? So left on its own, I mean, you have a nerve that's dying. It's kind of like that tree branch in your yard is dying. If you don't take care of it, it's going to die. And that's what we don't want to have happen because, the persistence of CIPN symptoms is a concern for the long-term cancer survivors. The pain and sensory disturbances can endure for months, even years, after you stop taking the medication. So it's like, here's one study, okay, 6.5 months post-therapy found neurotoxicity, which is going to cause the neuropathy, to be common in both 78.8% in the upper extremities, your arms, your hands, and 89.7% in the lower. And listen, sometimes it resolves on its own in 4 to 6 months. Unfortunately, it becomes irreversible in 60% of the individuals who continue to report complaints after 6 months. So that's a real big problem. I mean, it's just, it's just not a good scene. It's not a good scene, okay? Because what happens is now you're stuck with it. You got your cancer cured. So many different things can go wrong, and it's like, but I've seen enough good results that I'm encouraged. I'm very much encouraged when we help people. Lady just went on Alaskan cruise. She stopped. She had neuropathy for about the last 2 years after breast cancer treatment. She just retired. She went on this cruise, and this cruise she actually enjoyed herself, and that was only after about 6 weeks of care. Now she did in-office care and home therapy as well, and it's kind of like if the chemotherapy if the peripheral neuropathy is really that bad, you probably need to do both. But some of the mild cases, if you get treated at home, one, it saves you time, and guess what else? It saves you a lot of money. All right, so when you have, here's what to look out for: sporadic in the earliest stages, sporadic pain and numbness. The symptoms occur occasionally rather than constantly, and they're easily overlooked. It's like it aches, doesn't ache. You go about your day, which is wonderful. Stage 2 is where it becomes persistent pain and numbness, and the symptoms become more constant and more difficult to ignore. And this is typically when you start to think, I'm going to call my doctor up and see what he can give me for this. Unfortunately, most of the pills just don't work. I mean, they really don't. And at this point, you got to start knowing how much is that you want to prevent further nerve damage. So when people come in here, we do a nerve study and a thermal imaging scan to see if there's enough blood flow, see how the nerves are working, and we repeat these tests throughout care. And again, as long as someone's feeling better, that's the main thing. If they're feeling better, that's our goal. But also, too, is in a sense, it'd be false to say I cure neuropathy, because I do not cure neuropathy. I don't think neuropathy is curable. What we do is we give the nerve a fighting chance to work properly and to do its job by communicating with the brain and the peripheral nervous system. So the peripheral neuropathy is after it leaves the spinal cord, and you have all this stuff, all these things that connects to all the different nerves in the body. There's 9 different types of nerves, and we actually test each one when you come in. But I want to go to stage 3. This is debilitating pain and numbness, and it impacts daily activity. So walking becomes difficult. So what do? You sit down, you don't walk as much. Balance is significantly impaired. So you're going to sit down more because you don't want to fall. I get it. I mean, it makes sense that you don't want to fall. Now, the severe numbness at this stage increases the risk of injuries such as cuts and burns without resulting, with infection becoming life-threatening. And believe it or not, I knew someone years and years ago who was a bad diabetic. And actually, he drank too much, and you can get alcohol-induced peripheral neuropathy as well. He fell asleep with his foot near the fireplace, his foot resting on the fireplace, burned his foot, and as a result became incredibly infected and basically ultimately passed away. Now, I'm giving you the short end of the story, but I mean, he was not healthy to begin with and wasn't even aware. Okay, some people, if you drink that much and you're not aware of, that you can't feel pain or you're impaired, your balance is impaired, it's you're kind of past that stage of where anybody can help you. But at stage 3, severe numbness increases the risk of injuries, cuts and burns, infections, and they do become life-threatening, and I've seen it. So that's the thing. That's the scary part. All right, the stage 4, complete numbness. Walking is about impossible. The nerves are damaged and deadened. Patients at this stage face the highest risk of, guess what, amputations. I mean, and other severe complications, because you're starting to go, it's like you're getting flushed down the toilet and it's not getting any better. You're going to get worse, and you need to pay attention to this because very little you can do at stage 4. And I kind of like to get people between stage 1 and stage 2. That's where I have the most success. I mean, if someone comes in, you don't want to take a patient on if they're not going to have any chance for success, So sometimes the severity of symptoms is dependent on the cumulative dose of chemotherapy. Also, too, is for chemo-induced, it's radiation can have the same effect. So sometimes people go through chemotherapy and radiation or while, and then it's problem is, again, that coasting effect. And when it's dependent on the nature of symptoms at early detection, you can modify the dose so you can mitigate the nerve damage. And, when it continues to unfold, even after the chemotherapy stops, it implies, it's going to implode, basically. Self-propagating neurodegeneration is not what you want in this hand. So waiting for the symptoms to become severe is usually what people do. And most times they're going to go back to their medical doctor, look for that cure, but it's not really a cure. They're looking for a little bit of a lifetime so they don't sit in the couch all day and fade away. So that's what we're up against with peripheral neuropathy or chemo-induced, peripheral neuropathy. So that's pretty much the thing is. So again, we have stage 1 is sporadic pain and numbness. Occasionally, symptoms occur, easily overlooked. Stage 2, persistent pain and numbness. It's more constant problems and increasing severity. It's hard to ignore, but you can. Take a few Advil, get on the treadmill a little bit. Stage 3 is the debilitating. Activity is greatly affected. Walking is difficult. Balance is an issue, severe numbness. Stage 4 is complete numbness. Walking is almost impossible. And it's due to severely damaged and deadened nerves. It's not, can't let this just go on its own. So the question here is, what do you want to do? Well, what'll happen is, actually, I want to go back a little bit. The paresthesia, or numbness, is called hypoesthesia. And that's it's not that bad. You can live with it. But what happens too is this thing called allodynia, where you become hypersensitive to pain, okay? And some of the stuff you don't overlook on, because there's the damage to your system is not just to the legs and the hands, okay? They call the autonomic nerve system, which involves, it covers all the bodily functions essential for life, such as heart rate, blood pressure, regulation, perspiration, digestion, bladder control. So it's not a condition, but autonomic neuropathy does occur in conjunction with chemo-induced peripheral neuropathy. And I know I'm hitting you with a lot of big words, but I guess the thing to really stop and think about is, do you realize that you have a problem? The next thing is, understand there's a really good chance that it's not going to go away with pills. And if it does, great. I mean, I'm happy with that. It really does. But thrilled. You're not in my office, which is fine. I don't need any more pages. I got plenty as it is. And the stuff here, it's not, people don't tie it together. I have neuropathy. All of a sudden, my blood pressure's off. I'm perspiring. I got digestion issues, bladder issues. This is the stuff that you're not going to find on the label from Cymbalta and Lyrica and gabapentin. So I'm just trying to educate you. It's steps you could take, but the first thing is assess the nerve damage. Properly assessed nerve damage can make a tremendous difference in the quality of your life. And that's what you do is you come in, we have a thermal imaging scans to see if you got enough blood flow, then we do a nerve study and see how that works. And see how the sensitivity is. We see the nerves. There's other tests involved, but these are the easiest ones. There's no pain. A lot of times you go to the hospital for the nerve study, and that's pretty nasty stuff. So that's my story here. I'm Dr. Brian McKay. I'm not just a chiropractor. Well, I guess I am a chiropractor, but we do a lot of other things besides just chiropractic care, which is the name of my podcast. Thank you for listening. If you have neuropathy, you think you have neuropathy, I'm happy to take your call. 203-656-3636. Give my staff your number, and I'll call you back at a free time, and we can see if there's something we can do to help you or just at least put you in the right direction. Thanks for listening. I hope you got a lot out of today's talk, and we'll see you soon. Thank you.